morning, everybody. It's my pleasure and privilege to be here today. In the next 20 minutes, I would like to take you on the journey of the placental evaluation, the modern tools of ultrasound available on the Canon ultrasound equipment. And as we all know, placenta is a very unique organ. It exists only temporarily during the pregnancy, but it has a critical impact on the fetal and the maternal health, not just during the pregnancy, but there is also the emerging and increasing evidence in the literature that may affect the long-term outcome for the health of the mom and the baby. But unfortunately, we don't really know much about the placental function, and unfortunately, we don't know how to improve it and how we can impact that complications that can be associated with abnormal placental function. Generally believed that we have the early insult in the development of the placenta that later on that may result in the significant impact of the complications of the pregnancies, including the growth restriction and preeclampsia. And here I would like to show you that there is the very comprehensive tools on the ultrasound equipment made by Toshiba and Canon. And here we can look at the structure of the placenta, vasculature of the placenta, presence of the calcifications, and also do the sophisticated biometry evaluation using the 2D and the 3D. So here, I would like to focus in the next 20 minutes on the shear wave elastography and that technique for the placental evaluation. And here, I would like to show you the physical principle of the shear wave elastography, so that the high-power focused ultrasound pulse will be generated by the ultrasound system and sent through the tissue of the placenta that would result in the appearance of the side waves. And by measuring the velocity of those side waves, we can really estimate the properties of the organ, and this is widely used in the adult and the general ultrasound for assessment of the different pathologies of the liver and the thyroid. So here we decided to apply this to the placenta. And all this work was done and was possible because of the National Institute of Health back in 2015 launched the big project called Human Placenta Project. And we were lucky enough to collaborate with the Toshiba ultrasound systems and now Canon Medical systems to investigate the properties of the placenta and the ability to detect the problems with the placental development and function during the pregnancy using the shear wave elastography. So then we have those side waves, so propagation tracks that starts from the dark colors, and then it extends towards the more lighter colors. And also it's very important to understand that the shear waves are slowing down in the softer lesions, and they is the accelerated propagation, the high velocities, then we deal with the stiffer lesions. So this principle is basically can be transferred to the structural changes within the placenta and then linked back to the different pathologies. But first of all, I want to make sure that we know how to acquire the best image for interpretation. And now we are going to start from the scanning technique. And first of all, we need to make sure that they place the transducer correctly, so that the position of the transducer should be perpendicular to the skin and the abdominal wall of the patient. At the same time, the patient should be in the supine position. Also, it's very critical not to angulate the probe and make sure that the whole surface of the probe has the contact with the skin of the patient. So also, it's very important to keep in mind that the shear wave elastography is very dependent on the pressure that is applied to the abdominal wall of the patient. So use the minimal transducer pressure because excessive pressure may result to the overestimation and increased elasticity values. That would be definitely, the artifact related to the technique. And also you need to make sure that then we are looking at the appearance of the box, for example, here, that it's pretty much straight and not too much curved, so that may result in this artifact on the picture, and that would not be interpretable for future analysis. So that applying the Some pressure could be good because it helps to increase the shear wave penetration and overall color field within the box of the shear wave elastography. So then we are approaching the placenta. It's very important to make sure that the surface of the placenta displayed on your ultrasound screen has the horizontal position and is completely perpendicular to the direction of the travel of the ultrasound beam. And this will reassure that we approach and all the measurements and the technique is correct. Once again, it needs to be this horizontal orientation of the placental interface, the myometrium, and this is how we need to achieve the initial image. So also you need to make sure that then you're looking at the structure of the placenta, you can't really see any significant heterogeneity. Sometimes this is the part of the pathology, but generally speaking, you need to make sure that the area where you're going to evaluate the elasticity of the placenta doesn't contain any vessels or any strong reflectors that may result in the shadowing or the reverberation artifacts. For example, we would like to place the area for the shear wave acquisition somewhere here, and we need to avoid areas like that showing the subchorionic collection or bleeding, or if you have the significant calcifications within the placenta, note that usually within the third trimester of the pregnancy, or if you have any hypoechoic spaces like lacunae, we need to avoid those areas because then the tray is going to be very much affected. You will get the hot spots that should not be included in the measurements anyway. So the mapping can be incomplete in case of very stiff lesions out of the scale of range, so then you will have no field within the area of the interest on the shear wave, so those areas should be avoided. So the other very important consideration that the patients should have a gentle respiration. And here you need to establish the relationship with your patient and work as a team. Because usually it's recommended that the shear wave elastography is basically a quiet and the acquisition is very short because we use just one shot acquisition measurement. So that it's 1 to 2 seconds, then you need to push the button and let the system to collect this information. It makes sense to ask the patient to hold the breath, not a deep breath, but to hold the breath for this time in order to avoid any artifacts related to the maternal breathing. Of course, you cannot eliminate the push from the fetal side on the placenta and kicks from the baby, but usually it needs to be avoided as well in order to have the appropriate measurement. And that sometimes makes sense to practice together with your patient to hold the breath and then to acquire the image before you really go to the official acquisition. So the next thing that you need to think about how to place the area of interest within the placenta. And here it's very important to choose the area for shear wave analysis that would fit inside the placenta exactly. And ideally it should be about 5 millimeters distance from the interface to the myometrium and from the interface to the amniotic fluid. And the size of that area of interest should not include amniotic fluid to myometrium because that may affect the measurement. And how that will affect that the area near placental margins can be very stiff and do not represent the global placenta stiffness, so that your measurement will be overestimated. And you can see that those very bright areas here, this is basically from the myometrium because the muscle have completely different acoustic properties in comparison to the placenta, and you should not include that in your window. So the next thing to remember, and this is the limitation of the shear wave elastography, and one of them that it's very depth dependent. So if we are using the convex probes for abdominal scanning, so that the area that is really useful is about the depth of 5-6 centimeters. Anything below that will give you a really unreliable measurement, and this is really the limitation for looking at the placental elasticity in the third trimester, and in particular if the placenta is located posteriorly. So The next question is where to measure, so that we made sure that we acquired a very nice sample. So this is the picture in front of you, and I will show you on the live demo how easy to obtain this type of measurement. So how to apply the actual quantification area and got the specific number that represents the elasticity of this organ. First of all, you need to avoid the color dropout. So if you have no color around the entire area of interest, you don't really apply the measurement where you don't have color. So the other thing, that if you have a very strong reflector, so the hard spots, you avoid those as well. And then you can use, and we will see what tools are available to ensure that the measurement is correct and that helps the reassurance of the quality of the acquisition, so that you can use the propagation map lines in the area where the lines are parallel to each other. This is the best spot where you should measure and place that measurement area of interest. And once again, that you should not perform the measurement on the depth beyond the 6 centimeters. So here is an example of the abnormal or not very good acquisition together with a very inappropriate measurement. Why? Because we can see the lacunae here, that hypoechogenic spot here, and so the measurement here definitely doesn't represent the elasticity of the placental mass. And if you look at the lines on the propagation map, they are very chaotic. So in this case, we need to choose a different region and start over the acquisition. At the same time, here is the perfect example how the placental elasticity can be evaluated using the shear wave elastography. And here you can see the propagation map that shows you that parallel lines, they not necessarily need to be very tight, but they need to show the parallel pattern, and they reflect actually the velocities and the properties of the placenta. So, and this is how the measurement can be done and should be done. So also, if the image is good enough, you can use several areas of the measurements, more than one within the sample volume, and usually it's like up to 3 can be feed, and then they will be averaged at the end, and you will get the final report. So how do you know that what you're measuring is a good measurement? So there are several tools, and one of them is the measurement area detection, or MAD. So this is basically the net that can be overlapped or overexposed to the initial image, and that shows you that this little squares, right, or that areas that where the acquisition is correct and where the measurement is recommended. So this tool gives more confidence in where to place the caliper, and that provides the average measurement of the velocity or elasticity in kilopascals, and the standard deviation that of all the rectangles that you can see on your image. The other way to reassure that the acquisition is correct and the image is good and can be used for further analysis, this is the utilization of the propagation map, and this is the feature that gives user the ability to confirm where the shear wave are generated and travel as expected. So this map used in conjunction with the speed or elasticity map to enhance the clinical confidence, and you need to look for the parallel lines or curves in the propagation map to ensure a good sample. And I think that this is, pretty obvious that this is a very good sample here. So let me show you different examples how we can apply the propagation map. So here we have the excellent reliability, and we can make sure that this is like the perfect image that provides the best clinical information possible, because these results are reliable because the lines are straight and smooth and parallel to each other. Then there is a situation like this, where we have the area that has a good quality, and it's presented here, so we can see the smooth and parallel orientation of that propagation lines. But also we have the area that is not suitable for any measurements because the lines are chaotic, and here we don't really can get any useful information. And finally, this is the situation that the measurement in the image is not reliable. We don't really need to apply any measurements here. We should disregard this image and please scan again and start again. So the quality of acquisition also reflects on this image, so that should not be used for analysis, because if you have less than 50% of area of shear wave elastography box without color, or demonstrating the color dropout artifact, so this needs to be reacquired, and first the 2D image needs to be optimized in terms of the gain, and probably the best would be to apply the area of interest somewhere here within the 5 centimeters depth. So we place the measurement, so then how we can get the quantification. So we have two maps here. One represents the velocities of the spread of those side waves and is calculated in meters per second. And here you can see that we have the measurement within that sample area, and this is 1.42 meters per second. And also we need to pay attention to the standard deviation. It needs to be below the 0.3 meters per second. And also we may have the elasticity map that is represented in kilopascals and shows the actual elasticity. So once we acquire that measurement, we will generate the report, and the system will generate for you the report. Usually it has up to 10 measurements that can be averaged. And then generally for a placental evaluation, we recommend at least 5 acquisitions. And if we use several measurements within the same acquisition, so we can get an average 10 to 15 measurements that then can be averaged. And usually we use the median of all of those measurements in order to interpret and put in the final report. Similar, there is the Society of Radiology recommendations, and this is exactly the same protocol how to report the shear wave elastography that is utilized for the liver evaluation as well. So now in summary, let's summarize the protocol of shear wave elastography of the placenta. First, we need to put the patient in the supine position and make sure that the mom demonstrates no deep breathing, and then we will use the shear wave elastography area of interest box that will be placed with the margins of 5 millimeters away from the placental surface, and then we will make sure that we place this area of interest in the depth not deeper than 6 centimeters. We will measure the size of the area for measurement will be about 5 to 7 millimeters in diameter, and we will use the smaller size for the early gestation, and in the second trimester and later in the third trimester we will use the sample diameter of 7 millimeters, and in several circumstances we can go as high as 10 millimeters in diameter circles area for measurement. So then we make sure that we will place those areas for measurements in the homogeneous area of the placenta with a very nice color fill, and we will orient ourselves on the smooth and parallel propagation lines, and finally we will use 1 to 3 measurements per box of the shear wave acquisition and report the median value of at least 5 acquired measurements. So what are the important notes? That the compression should be avoided because the elasticity values can be really overestimated, and then the liquids are really not very much friendly to this technique, so that the shear wave do not propagate in the non-viscous fluids. So this may result in the different artifacts. So that's why, once again, one of the limitations applications of the shear wave elastography during the pregnancy. This is the application for the posterior placenta and in particular in the third trimester. So also it's important to ensure that people who are doing this type of the exams, they have the extensive background and some experience with using of shear wave elastography in general ultrasound, and that results never should be interpreted along and always correlated with the clinical or other imaging techniques. And in particular, this is true for the placental evaluation because it's still a very much novel tool for assessment. It's not ready for the clinical use, and most of the time it's really used within the research settings. So then we started this project that was almost 10 years ago, so that we were really have no reference values at that time, and that was a question like, how do you know if it really works? And how do you know that it really helps to distinguish the acoustic properties of the different tissues within the placenta? So we tried this technique on the model of the chorioangioma. So we collected the shear wave elastography data from the chorioangioma and the normal placenta within the same patient, so that we eliminated any impact of the patient's BMI or the other scanning conditions in these cases. So, and we had 5 cases to start, and we clearly demonstrated that the shear wave elastography was able to provide the quantitative information that describes the differences in the different placental structure, such as the chorioangioma tissue and the real placenta tissue. And for chorioangioma, we had much higher values of the shear wave elastography. So the other very important aspect, and I have to mention that to you, that because that's the physics and nature of this technique, pretty much includes the sending of the pulse that then result in the tissue displacement and that side waves. So there is always the concern for safety, particularly when it's used in pregnancy, but there were several papers published showing that indeed the impact and the potential artifacts are not different from the other ultrasound modalities, such as the grayscale or the Doppler ultrasound. However, there were other publications showing that the shear wave elastography can result in significant increase of the temperature, and it's more significant than for 2D and the Doppler in general, and that happens along the entire line where the push pulse is sended. So, and in the near zone and the far zone, and this is really needs to be considered when you're applying this technique. So in conclusion, I would like to say that the shear wave elastography is the novel diagnostic ultrasound modality that offers potentially the possibility of the quantitative assessment of the tissue elasticity of the placenta. It may have the numerous potential applications in obstetrics and the fetal imaging. It's really very little known about the potential artifacts and the harm to the tissue of the fetus, in particular of the placenta. So that can be unique for this modality. And it's very important to keep in mind that most of the time when we use this technique, it's still reserved for the research projects, even though if you Google that and look at the literature, more and more centers utilizing this technique for their research projects. And I believe that one day it's definitely going to be somehow used in the clinical practice. And then you perform the shear wave elastography within the research settings. It's very important, it's critical to adhere to the standard protocols and the safety principles such as the ALARA, and also the minimize the thermal and the mechanical indexes, and this is mandatory. And I think that you all agree that we need to make sure that the safety of our patients takes the priority. And here I would like to stop. I hope that this presentation was useful for you, and I would like to extend a special thank you to the partners who I work very closely with, the Canon Ultrasound Medical System. This is Karen Bagger and Paula and Todd, this is my American team members. And I would like to thank Canon Medical for the continuous support and collaboration over the years. Thank you very much for your attention. So we are ready for our demonstration, and we are utilizing ultrasound system, Apleo i800, and this is Prism Edition, and we will be using the high-frequency convex probe i10CX1 for this demonstration. And first, we are going to take a look at our basic evaluation so that our patient is about 30 weeks gestation. We are scanning to determine the fetal position within the uterus. So fetus is in the cephalic presentation. Here we can see the location of the placenta. It's anterior. This is really the best for the assessment using the shear wave elastography or any other techniques that we didn't discuss today, but indeed can be used for the placental assessment of the structure vasculature. And we can see that fetus is laying the head down. We have the spine oriented along the maternal left side. We can see that on the image, the left is down here, the right is up here, and we can see the normal amniotic fluid, and we will start from just a very quick assessment of the fetal anatomy. We can see the lower extremities, and we can really see the cord insertion. We can see the bladder. We can see cross-section of the kidneys, the stomach, normal situs, four-chamber view, three-vessel trachea view, upper extremities, and the head. So, but the focus of our evaluation is the placenta. That's why we are going to optimize the image of the placenta. We will adjust the depth. We will maximize the placenta. We will not apply any pressure at all. And here we have a very nice area that doesn't demonstrate any big vessels or any lacunae, so that we will activate the shear wave elastography box. We will make sure that there is like the box is away from the margins, and then we will do the one-shot acquisition. So we will go and we'll, oops, the baby is pushing. Right, so we will wait a second, and then we will just acquire one acquisition. And you can see that at this point we have the measurement area detection, and you can see all those rectangles that actually the system detected that it wants to measure. And here we have the very average. We have the very average measurement of the velocity map. It's 1.59 meters per second. And please look here, the standard deviation shows that this is a very good quality of acquisition, because the standard deviation is less than 0.3 meters per second. So yeah, we can use that averaged measurement, or we can really take this away, and we can use the single area that presented here. So as I said, the size of this region of interest, that circle shape, and then it's like size 5 millimeters, and we should apply that at the area where the lines are as parallel as possible to each other, and I think that would be reasonable to place it here. And then we can use several measurements within the same box, and we can apply here and probably here as well. So here we have a little bit of the lacunae behind. So, and that would be really nice. So then we can change the speed map to the elasticity map, and you can see that all our measurements all of our measurements are actually going to be in kilopascals. So, and you can see that here the kilopascals together with standard deviation are shown. So also we can use a different part of the placenta and do it all over again. I will show you very quickly. So this is how you can place the sample, and look at this absolutely stunning picture that shows that parallel smooth lines of the shear wave. And here we can look at the speed map, and we can see the velocities are really low. That is typical for the normal placenta. And here I'm not going to put too many samples, but you can see that we can switch from the speed to the elasticity map. And indeed, if you follow all those instructions that we discussed today, it takes like really a split of a second to get that very valuable information. So we also can, it's okay, just to demonstrate on the other technique that we can use for the placenta. This is the vasculature, and here we can really look at the teeny tiny vessels that can be found within the placenta. And here we can really optimize our image by using different maps, and I will demonstrating them to you, but this is my favorite, number 11. And also we can adjust the how luminant and how the 3D effect the color has, and we can really go down. This is like really flat, but if we will increase the luminance option high enough, so this is the highest possible, this is number 5, I think that you can appreciate how nice the picture looks here. And so that we can really see those vessels very nicely, and then we can place the spectral Doppler sample volume here, and then we can measure that velocity and the trace in our in the vessels of the fetal side of the placenta. As you know, the vein and the artery, they run in parallel, so that you can actually move from one to another. And so here we have blood flow, and we can adjust using our magic wheel. We can adjust the scale, and this is the last time. And this is the vessels of within the fetal side of the placenta. And here we can measure the pulsatility index and resistance index, exactly the same how we do for the other vessels, such as the umbilical artery or the uterine arteries. So that could be also a very useful technique for looking at the placental function in terms of the vasculature. And I think that our time is up. I don't want to hold you more. Once again, I would like to thank Canon Ultrasound Systems for the opportunity to meet you today. And if you have any questions, I will be happy to answer them, maybe, outside the room. Thank you very much. And let's extend the thanks to our patient who was so nice to come here today and help us with this demonstration. Thank you very much.